Hi, myself Dr. Anju Balakrishnan, Ayurvedic consultant, and today we are going to clear few doubts regarding deviated nasal septum. So the first question is, what is deviated nasal septum? DNS is a sideways displacement of the wall between the nostril. In many people, the nasal septum is off-center or deviated, making the nasal passage smaller. In severe conditions, it may block one side of the nose, reducing the air passage and finally leads to breathing difficulties. And the second question is causes of deviated nasal septum. The DNS can also occur during the time of birth. DNS can also be the result of injury to the nose, and that causes the septum to move out from the actual position. Frequent swelling and irritation in the nasal cavity can further narrow the nasal root and further worsen the conditions like nasal obstruction. Coming to the third question, what are the symptoms associated with deviated nasal septum? First and foremost, there will be nasal obstruction, and DNS is also one of the reasons for noisy breathing. The surface of the nasal septum will become more dry and it is more prone to nasal bleed. Now, what are the complications of deviated nasal septum? Since the nose is blocked, the person starts breathing through mouth and there will be disturbed sleep because of this. What are the diagnostic process of deviated nasal septum? Usually, a bright light is required to view the nasal cavity, or fiber optic nasal endoscopy, that is the examination that is done to view the nasal passage. Next is the CT scan, that is the imaging techniques, but usually it is not used to diagnose the condition. And the next question is, can DNS be managed without surgery? The main concern during the DNS is nasal obstruction, and this nasal obstruction further worsen if there is any allergy or infections. And by treating this nasal obstruction, one can breathe through his nose and the condition will be subsided. If the condition is severe, then the surgery is the best line of option. The next question is, can nose blockage due to DNS can be managed with medicines alone? So as I mentioned earlier, the main concern during DNS is nasal obstruction, and it further worsen because of these allergies, and if we treat these allergies, these can be subsided. And the last question, in what circumstances a surgery is must for DNS? So it depends upon the person. If the condition is severe, obviously your doctor will prescribe for surgery. If you have tried all other treatments and still there is no recovery, then surgery is the best line of option. DNS is one of the burning problems that is faced by majority of the people nowadays. So better to consult a doctor before the condition worsens. If you have more doubts regarding DNS, please post your queries in the comment section and I would love to answer those. Thank you. See you in the next video. To watch more such interesting videos, stay tuned.